Good morning. My name is Rondi OSCE. I am from Southwestern University, a second year med student. What's your name?
I'm Kinley C. Fernandez,
How old are you, Kinley?
38 years old.
Is it okay if we do examination of your abdomen today?
Yes, it's okay.
It's okay. Do you have any pain or feel any discomfort?
No.
No? Okay, very good. Before doing any inspection, we also have to make sure that the patient is relaxed, that the abdominal area is not flexed, otherwise it would alter any of the sounds or percussion or palpation. Now we're going to do inspection, any unusual discoloration, scarring, jaundice, even dilated veins for portal hypertension, peristalsis, any kind of discoloration in the striae as well, if there's like a purple striae for Cushing syndrome. Also checking for any bulging flanks, for any ascites, any distension, also for hernias, any rashes that might be occurring in this area here, if there's any symmetry, if there's any bulges, or any visible pulsations that occur. So let's check right now. Looks like it's normal. I don't see anything unusual at this point. Okay, good. During auscultation, we want to make sure to do it first before percussion or palpation, because if we do those two first, it will alter vowel sounds, and the stimulation might also increase peristalsis. So for normal sounds, you'll be listening in for clicks, gurgles in irregular patterns. If you notice any hyperactive sounds, there might be mechanical obstruction, or trying to overcome the mechanical obstruction. The clicks and gurgles are about greater than 30 per minute. Also, if you notice any hypoactive sounds or no sound at all, there is paralytic ileus, or maybe signs of peritonitis. And we'll be going over the aortic area, just above here. And then 4 quadrants. And also checking in femoral area. Sounds like everything is normal. We're also checking for bruits. If the patient is hypertensive, then you will be able to appreciate bruits. Using percussion to assess the amount of gas in the abdomen, also solid organs, any kind of masses that might be there, or fluid-filled sacs, or also for the liver and the spleen. Also check the first 4 quadrants. Lower right quadrant, and then I'll make our way clockwise. We're also checking for the tympany. Tympany is when there's hollow sounds, versus dullness, which is either organs or masses that might be closer to the surface. Next, we're going to also palpate, first with light palpation. I'm going to be using 9 regions. Any comfortability? Are you uncomfortable or okay? During palpation, you're going to note for guarding, watch the patient's expressions if there's any kind of pain. Next, we're going to go for deep palpation to detect if there is any abnormalities. Yeah, investigate. So there isn't anything unusual there. We're going to do percussion and the liver span of the liver. First, start here at the midclavicular line, starting at the nipple line and going down to check for dullness. That's where we'll be able to identify the upper edge of the liver. And then afterwards, looking for tympanic area, going upwards to find the dullness on the bottom edge of the liver. Here, and then so from here, we're going to take a ruler. And measure how many centimeters there are. Normal liver span is from 6 to 12 centimeters. Here, we have approximately 8 centimeters. Hitting the liver, go towards the costal margin from the midclavicular line, way below the right lower quadrant first, just to make sure that we don't miss any large masses. So first, I'm going to hook my hand underneath the patient, and I'm going to press downward and forward to check the liver's edge. When you're palpating deep, to check for the liver edge, the normal liver, normally a little bit soft, it's sharp with a smooth surface. Normally it's a little tender, and it looks like it's fairly normal here. I can feel it in my fingertips. Also, we're going to perform the hooking technique to check the liver edge. This is mostly used for obese patients. With the hooking technique, you're going to find the lower margin of the ribs, and you're going to hook your fingers in, ask the patient to take a deep breath, and then exhale. You'll be able to feel when the liver descends. So go ahead and take a deep breath for me, and exhale. There it is. You can feel that. Next, I'm going to check for the urinary bladder. I'm going to assess where the dome of the bladder is using percussion and palpation. See where your pubic symphysis is, which is about there. Check here. I'm going to feel if there's any lower edge. Normally, you will not be able to appreciate the bladder unless it is distended. It feels like it's normal, so there's no issues here. Next, we're going to check for kidney palpation. I'm going to ask you to turn a little bit for me, and go ahead and come back down. We're going to do a deep palpation to check kidney, which we know is lower costal margin. Yeah. I'm going to do the same thing on the other side. Go ahead. Okay, then come back down. Relax. And I could not really appreciate the kidney. Normally, if the kidney is felt, then there might be enlargement. Next, we're also going to percuss for the tenderness of the liver. We can do so in the back. Our kidney, the right kidney is just about 3 centimeters below, just because it's pushed down because of the liver. You're going to place your palmar aspect, and you're going to use your ulnar for fist percussion. So checking to see if there's any pain in the patient. Next, we're going to check for appendicitis, assessing it with a few special techniques. Rondi sign. With this, you're going to palpate deeply in the left lower quadrant, and if there is pain in the right lower quadrant, it's a positive Rondi sign. Palpate deeply and evenly in the lower left quadrant. And then quickly withdraw your fingers. This is to check for referred rebound tenderness. Next, we're going to be doing the psoas sign. The psoas muscle is close enough to the appendix that if the appendix is inflamed, tension with the psoas muscle would further irritate the appendix. So I'm going to place my hand just above the right knee, and I'm going to ask the patient to lift his right knee. Can you lift your right knee, please? Feel any pain? No? And that is a negative psoas sign. Next, we're going to do the obturator sign. This is less sensitive for indication of appendicitis. I'm going to ask the patient to turn to his left, so go ahead and roll to your left here. Okay, and then I'm going to bar your leg here for a second. I'm going to flex his leg up and then outward. You feel any pain? No? And that is an indication that obturator sign is negative. Lastly, we're going to go over the Murphy sign, and this is to check and see if the gallbladder is in fact inflamed. I'm going to place my hand just below the costal margin on the right side, palpate deeply, asking the patient to exhale first, press down, and then inhale. So go ahead and exhale, out, and then inhale, and then exhale. So what's going to end up happening is, if the patient has an issue with his gallbladder, it's going to wince in pain. And that concludes our abdominal examination. So this was a normal abdominal examination. His abdomen was rounded, normal. There was slight bulges, but it's also just very slightly. No abnormal masses, no abnormal bowel sound, no bruise, no flanking. Tenderness was not seen. Tympanic and dullness sounds were as expected. The liver span was 8 centimeters when measured in the midclavicular line. It was not sensitive, so everything is normal there. I performed special techniques, issues with the liver, or if there was any appendicitis. He was also negative for cholecystitis. There were no palpable masses and no CVA tenderness, and everything is normal.